Hello everyone, welcome to Math Podcast. Math is Machine Learning Artificial Intelligence Technology Hub by Department of Science and Technology in collaboration with T-Hub, the world's largest innovation campus. Today we are honored to host Dr. Pravin Krishna Vaddavalli, a visionary leader in ophthalmology and technology. Dr. Pravin is the Network Director for Technology and Communications and the Director of Shantilal Sangvi Cornea Institute at LV Prasad Eye Institute. He is a globally recognized expert who has pioneered innovations in corneal surgeries and refractive treatments. He has earned various prestigious awards, including the Young Investigator Award from the Association for Research in Vision and Ophthalmology. With over 110 peer-reviewed publications and 700 plus presentations worldwide, he is a visionary who is shaping the future of excellent and equitable eye care. He is here today with us to share his insights on AI and healthcare, especially in ophthalmology. Welcome to the Math Podcast, Dr. Pravin.
Thanks a lot, Srinidhi, and thank you to Math as well as Capsico Health for the podcast as well and the invite.
Pleasure to have you on board. You've had an incredible journey when it came to ophthalmology and how you've included technology as part of your work. So can you share a bit about your journey and some of the key milestones, especially your passion for integrating technology with your work?
Yeah, that's an interesting question because my career has been more of a medical doctor. I specialized in ophthalmology and then went on to specialize in cornea. And I think once I started working in the area of refractive surgery, which is laser eye surgery, the possibilities of integrating technology then became evident because refractive surgery means a lot of numbers and it also means a lot of math and a lot of physics as well. And when you move away from all of these in your medical career, you're brought back into the loop by working in these areas. And I think also the fact that AI as well as technology, the revolution that seems to be sweeping the world and is on everybody's lips nowadays, I think forced us to look within to identify which areas where we could potentially benefit both providers from the point of making them more efficient, probably enabling them to make better decisions, and also to help our patients to access healthcare providers better and also potentially cut down the time, cost, and as well as the duration of treatment that we can provide them with. That's, I think, the genesis of my personal interest and I think our organization's interest in AI and technology and how to blend it with healthcare.
Thank you for sharing that. From your experience, what are some of the groundbreaking technological advancements that you have seen through AI applications in healthcare, in specific ophthalmology?
I think in the open domain, what most of us have heard about applications of AI in making early diagnosis and also in reducing the treatment curve for patients. Some examples, I think, for those of you who have been following the news, about 8 years ago, Google launched their first AI-enabled retinal imaging concept, where it was promised that diabetic retinopathy could be detected by a picture of the retina and several other systemic diseases as well. Since then, there have been a lot of publications in research that promise that, as of now, last count, more than 30 systemic diseases can be detected by one photograph of the inside of the eye. So if something like that is possible, I think the extent to which we can drive simple photographs to give us early diagnosis is immense. In addition, I think in pathology and in radiology as well, there have been some companies who started launching products that would be able to detect abnormalities in scans that the human eye would probably miss. And I think this is very exciting because as of now, doctors generally are at various levels. You have those who are really well trained, experienced, and most of us tend to solicit the care and services of somebody who has more experience. And AI has the potential to be an equalizer, where with the advent of AI, a doctor who probably is not as experienced, not as well trained, can probably reach the experience level and training level of somebody who spent several years in the field. And in several ways, because in a country where we have a shortage of healthcare professionals, This reduction in the learning curve, I think, will probably be a game changer in the kind of service that healthcare professionals can provide to patients.
Dr. Praveen, today generative AI is being hailed as a game changer. So, how do you see it impacting patient diagnostics or imaging or any other aspects in healthcare itself?
I think that's really interesting question because we've seen some groups, especially out of Taiwan, Japan, and China, do a lot of work on generative AI, and we've been exposed to some of the images that have been produced by generative AI.
Okay.
I'll give an example. Say, for example, if you have, I'll talk about the eye because I'm primarily involved in that. If you have images of the inside of the eye, and Gen AI can potentially construct an image of how an eye will be with changes inside the eye after, say, 5 years or 10 years of diabetic retinopathy or hypertension or some such diseases. And the advantage of this is the fact that maybe patients as well as healthcare providers can look at these images and then prognosticate how a patient would potentially evolve, how a disease would evolve over time as well. Though it looks fascinating, on the ground, Gen AI is probably not going to make a lot of difference in the early diagnosis of disease.
Okay.
And I say that because in a country like India, I think we have a lot of patients and we have a lot of diseases as well as a lot of data that comes from these patients and diseases as well.
True.
And when you are able to put together true data, that is any day much more valuable than potentially synthetic data that is generated by Gen AI and then that is evaluated over time as well.
Okay.
Gen AI probably is useful in rare diseases where we don't have adequate data or adequate images for us to analyze in the future. But I think the true value of Gen AI will probably be in two areas.
Okay.
One is for patients, for them to understand what will happen if an intervention is not given to them at an appropriate time. And I think the second is going to be in education. Being able to teach medical students as well as specialists the evolution of disease over time using Gen AI and is, I think, a fantastic learning tool for them because a lot of learning in ophthalmology is out of imagination and out of visualization of what might really happen. If you can use Gen AI to actually demonstrate what will happen over time and what interventions will change the outcome of certain disease processes,
Okay.
I think it'll be a fantastic learning tool.
That's actually quite interesting. But have you witnessed anything happening in education of medical practitioners to actually utilize Gen AI tools to understand these changes that are happening in eye or like in healthcare? Like, have you witnessed this application of tools?
Yes, I think in teaching, especially like anatomy of the human body,
Okay.
there have been several models, 3D models of the human body that have been constructed over time.
Okay.
And now medical students, when I was training, it involved dissecting on a human body to understand anatomy and also the variations in anatomy.
Okay.
Now a medical student can slice and dice a 3D human body
Okay.
and understand the variations in anatomy and how it is constructed. I haven't seen Gen AI being used for this, but I'm sure that in the future you can apply Gen AI to these kind of 3D models
Okay.
and also allow them to discover and also look at how disease will change anatomy as well as physiology of the human body as well. This is at a very large non-cellular level. But for researchers as well, who are looking at the effects of, say, microbes, pathogens, antibiotics, drugs at the cellular level, Gen AI has the potential to also construct potential changes that either of these interventions will bring in at the cellular or the molecular level.
Okay.
And I think that will be an amazing research tool for them as well. And potentially, we will not see as many experiments as we see on either humans or animals. And most experiments probably will happen either in simulation on a lab, either on cellular models, or probably on mathematically generated models that will simulate the effect of various drugs as well as pathologies at any level you want in the body. And I think that is going to be very exciting.
Sounds really exciting to me. And talking about research, you have about 110 plus peer reviewed research publications. In your experience, what were some of the challenges that you have faced or some of the AI applications that you have witnessed during these research papers?
I mean, thanks for alluding to that, because I think most research in the early part of my career was based on disease as well as changes within the eye and various conditions. But if you look at the body of research that is available right now, large majority of research is emanating from the world of AI and data science.
Okay.
But the funny thing is, a lot of this research isn't really translating into implementation on the ground, because it seems as if there is a problem everybody thinks of, which is great. And then we think of a solution and we think of how to solve something using data science. And once you do that, it is something that you would like to share with everybody, and that is eminently publishable. And so these are cycling through research journals very quickly.
Okay.
But then if you look at the body of research and how much of that research is really applicable on the ground, it probably is going to be a very, very small amount of that we can apply on the ground. And the reason is adoption of AI as well as data science on the ground. Typically, doctors, very egoistical individuals, allowing them to be told that there is somebody out there or something out there that could be better than you or probably could do a better job than you is going to take some time, I think, to sink in.
Okay.
And I think it's going to be generational as well.
Yeah.
I think the real adoption of research in AI and also the tools that are made possible by AI is probably going to happen in the next generation of physicians, probably not in this generation.
True. I mean, I think as you were saying, the adoption is not, I think, restricted to medical practitioners. I think it's restricted to generation. But then as the generations are evolving, they look at Gen AI or AI in general as a tool, not as something that is going to replace what kind of good work that we're trying to do. You've spoken about equitable eye care. So how have you seen AI helping in bridging the gaps in the community, especially when it came to underserving communities?
Sort of limit my answer to the geography that we're in, which is India.
Okay.
And I think in India, there are several divides, social, economic. But I think the geographical divide between rural and urban in the medical space is very real. Because the availability of medical facilities in rural areas in India still remains quite scarce or sparse. Mainly because the best healthcare providers, the best trained doctors are usually in the urban areas, and you won't find a lot of them in rural areas.
True.
Here is the challenge, and herein lies the opportunity for AI as well. Because several healthcare workers or paramedical workers who are not doctors are available in rural areas. And I think their abilities are limited by the amount of training they have, as well as the ability to detect and to diagnose and to appropriately triage a condition and to determine whether the patient in a rural area needs to be referred to a higher center or they can be treated there. And I think the ability of AI and data science to, with various machine learning models, to detect diseases in their early stages and then to be able to prognosticate them, to look at how they're going to evolve, will be able to equip healthcare workers in rural areas with the tools to make decisions on behalf of patients, reducing the time that patients will need that they need to travel to urban centers, reducing the cost of travel because they might not need to travel to urban centers. And I think to some extent also reduce the social divide because we've also noticed that there is an inequitable distribution of resources from the point of view of access to health between males and females, especially more in rural areas. And potentially having tools in rural areas in the hands of healthcare workers that maybe a rural population is familiar with will probably allow them to access more of health in rural areas as well. I think that is what we are most excited about. Our organization has a pyramidal system of care where we have centers located in urban cities as well.
Okay.
But the vast majority of our centers are in rural areas. Over 300 of our centers of LV Prasad Eye Institute are in villages, single room clinics that are staffed by what we call a vision technician. A vision technician is either a 10 standard or a 12 standard pass technician, sourced from the community, who is able to screen eye diseases. But if we equip him with tools like machine learning models and AI to be able to detect disease and also to triage them, and then bring in teleophthalmology or telemedicine to be able to connect doctors sitting in urban areas to the rural areas and get opinions about complex diseases, I think will probably solve this urban-rural divide problem that we're having in the medical field in a big way. I think that's what excites me most when it comes to AI and data science in the future.
True. Dr. Pravin, AI is revolutionizing patient care and diagnostics. So, how do you balance now the introduction of AI and all the technological advancements that are coming in with the human touch in patient care?
Yeah, I think that's a difficult one because a lot of our patients are still wary of interacting with an entity that is non-human. In medical care, I think trust and familiarity go a long way in bridging the gap between patients and providers as well. Having to interact with a non-human interface or having a non-human in the loop for AI or ML models, I think is going to take a long time to become reality. And it is important to have a human in the loop right now because I think in addition to validating several models before they actually are used for clinical care, I think validation is a continuous process. And the variables that come into healthcare with pandemics, epidemics, change in socioeconomic constructs as well, will need to be validated over a much longer period of time than what typical validation is applicable to non-medical science or areas outside of healthcare. And I think for that reason, both from the point of view of models that will help detect disease and a human in the loop is probably going to be very important because a human in the loop will potentially also improve the model over time. Secondly, I think it brings in a level of trust both for providers as well as for seekers of healthcare that this is validated by somebody they could probably interact with and they could probably trust. So at least in the current generation and hopefully in the next as well, I see that it is going to be more about augmented AI where you have humans along with AI that will work in providing solutions for healthcare rather than human agnostic AI.
Makes sense. So now we see that AI is the future. Now we call this the age of AI evolution. The revolution has already started. So, in your predictions, what are some of the near future advancements that you would predict or you're foreseeing in healthcare when it comes to AI?
I think most advancements in healthcare will probably not come from healthcare providers. Most advancements probably will come from large healthcare systems or the ecosystem around healthcare systems like governmental organizations, insurance providers, medical equipment manufacturers, where they will probably incorporate a lot of these solutions into the tools that they already provide. And I think large medical conglomerates probably will utilize AI much earlier than the doctors on the ground or the doctors they employ. For the simple reason that I think utilizing AI is a great business case for large organizations where they can improve outcomes, they can improve their revenues, they can improve their bottom lines, and they also can cut healthcare costs to a large extent. And I think if the government also realizes the value of ensuring that good data is flowing in from whatever they're collecting on the ground, and they can implement AI to also cut healthcare costs in the future, that I think is going to be a game changer for AI. But I don't believe that either doctors or healthcare providers are going to be the source of most of the revolution that's going to happen in the medical field in AI. And I think another area where India probably hasn't caught up yet with the West, I think, is with insurance providers. If you look at the scenario in the West, especially in the United States, I think the insurance providers probably have deeper insights into disease patterns and about evolution of how diseases will behave over time. The decisions, though, they make because of that data probably are not the best, but I think they probably have deeper insights with large amount of data, and I think that's going to happen in the healthcare industry in India as well. And I think that's where the next revolution will come from.
Makes sense. Just a follow-up question on the data perspective. Right now, what we do observe is the healthcare organizations, the data is quite unstructured because traditionally we haven't collected it in a very structured format so that you can feed them to the models and create solutions to specific use cases. So do you see that change happening in organizations now where they're capturing data in a very structured format so that they can have a future applications in technology?
I think that is fundamental. I think that's a great question because the biggest lack of resources currently in our healthcare ecosystem is the lack of good data.
Yeah.
I mean, LV Prasad as an organization, we've implemented electronic medical records in 2011. So we've been able to collect structured data for the last 12 years, 13 years. I think that has been the greatest solace from the point of view of being able to build models, because you can go back in time and you can mine a lot of data that is useful, and that will be useful for the future as well. As we speak, we are currently in the process of ensuring that the data becomes more structured. But then again, most healthcare organizations have only started to adopt electronic medical records as well as ERPs only in the recent past. I think the government has also mandated that most providers should have electronic health records. And I think unless we have a robust system of collecting data, storing data, analyzing that data, we are not going to be getting great models anytime in the near future. And because of this, our over-reliance on models that come in from the West, again, are not applicable to healthcare, because I think the genetic makeup, the kind of problems, the kind of diseases that we have in our subcontinent, very, very different from what the Caucasian population would have. So we cannot rely on models that are coming in from the West to make decisions in healthcare unless we build our own models, validate them. And for that, we need good data.
Thank you. I think that's very insightful with respect to data.